Fall is finally here, and with the changes in weather also come changes in our skin. As the air becomes cooler and drier and the humidity level drops, this can wreak havoc on your skin. It can alter the skin barrier, it can increase transepidermal water loss, and it can make you more sensitive to actives that you can usually endure during the summer months. So after watching this video, hopefully you'll gain some tips and tricks on how to keep your skin healthy during the fall months and how to transition your skincare routine to adapt to the changes with the fall months. My name is Dr. Stephanie Capel, and I'm a board-certified double fellowship-trained cosmetic dermatologist in Newport Beach, California, and I'm here to provide free educational content for you guys that's unsponsored, science-based, and unbiased. So one major change that happens during the fall months is the level of humidity in the air. And this can wreak havoc on the skin because everything in science is in flux and things go from higher concentrations to lower concentrations. So if you're thinking of the skin on cross-section and you have dry air that is depleted of moisture and there's moisture inside the skin, it's going to want to go through a process that's going to go from higher water concentration to lower water concentration, which we call transepidermal water loss. Literally, the water is getting sucked out from the skin into the atmosphere because of the drop in humidity from the winter and fall climates, but also space heaters and heaters that can deplete the atmosphere and the air from moisture. It sucks it out of the skin more. And so it goes in that kind of concentration gradient. So the most important thing to do during the fall months is to increase your hydration status. Not only by drinking more water, I usually say 2 liters of water a day is preferable. It may vary depending on your size and your height and weight, but usually 2 liters a day should suffice. So if you're usually getting that in the summer months, maybe increase it by 500 cc's or another liter more, because internal hydration will have an effect on your skin's hydration status. So you want to hydrate from within. You also want to hydrate from the outside. So endogenous is from the body drinking your water. Exogenous is from the outside moisture kind of protecting the skin, and that's called exogenous. And those are the topicals we use. So usually you want to go from the summer months where you're using a lighter moisturizer or a lighter hydrator to maybe a heavier cream or a heavier moisturizer that's packed with natural moisturization factors like hyaluronic acid, glycosaminoglycans, ceramides. Ceramides are really, really important because they hold onto water. They bind water and they hold it inside the skin. And it also will reinforce that barrier to minimize transepidermal water loss. So switching to a heavier moisturizer, of course you want to get one that's non-comedogenic, especially if you're acne prone, but will have an impact on your skin's hydration status as we enter the dry and cold fall months. Also, using space heaters or heaters in the house can deplete the atmosphere and the air of moisture. So by counteracting that, by having a humidifier or a mister, of course you want to keep it clean because there's been an increase in Legionnaire's disease and other things that can happen from, humidifiers and diffusers. You want to be really careful to make sure that you keep it clean and keep up your hygiene, and make sure that if you're using a mister or humidifier that you're cleaning it regularly and putting water back into the atmosphere that's getting depleted from not only the seasonal changes, but also space heaters and heaters in the house. And that will help keep your skin more hydrated as well. Also, as much as I love a hot shower, you want to avoid hot showers for a prolonged period of time. Having warm or even tepid water, if you can stand it, will help keep the hydration status within the skin more. When the skin is heated with hot water during a shower, there's more leaching of the skin's water into the outside atmosphere as well. So you want to have your showers or baths be a little bit more tepid. They don't have to be cold, but not as hot as sometimes we would like them to be. And if you do take a hot shower or go in a hot tub, especially if you're out skiing or snowboarding and you want to get in the hot tub with your friends after, a fun day, just be sure to hydrate afterwards and just seal in that moisture, because remember, the skin is like a sponge. If you leave a sponge out that's wet, it'll get dry and cracked and brittle, and that's how the barrier gets disrupted. But when a sponge is nice and soft and wet, and then you seal in that moisture by a coating that goes over the skin, like an ointment or a hydrator or a moisturizer, of course, one that's not comedogenic, but for the body, you don't have to worry about that as much. You want to seal in that moisture so it decreases the transepidermal water loss and keeps and retains the water molecules inside the skin. So next is exfoliation. you guys have to be really careful during the fall months with over exfoliating your skin. I definitely tell my patients to cut back on the level of exfoliation. Now remember, we have mechanical exfoliation with a mechanical exfoliating scrub, and we have chemical exfoliation, which kind of chemically exfoliate the skin cells by decreasing the connection between the cells, which we call the desmosomes, and it has a gentle exfoliation process with alpha hydroxy acids, beta hydroxy acids, so lactic acid, salicylic acid, glycolic acid, whatever acid you're using for your chemical exfoliants, maybe cut back in half, or maybe even if you're using it every day, do it maybe every other day, or maybe if you're using it 3 times a week, use your exfoliant maybe just once a week. And I always feel like a mechanical exfoliation during the fall is a little bit gentler on the skin, and you want to get not so coarse of an exfoliant. My MDAiRE Cloud Polish also has a very micronized, very gentle exfoliation kind of grit to it. So it's not going to overstrip the skin, but it's going to break up all the cellular debris, dirt, oil, makeup, layers of sunscreen, and everything that can rest on the face and could cause premature aging. So have a gentle exfoliation that you cut back on just a few times a week is my advice, and to minimize breakouts, minimize dry, itchy, peely skin, eczematous dermatitis, and irritant contact dermatitis as well during the winter and fall months. Next tip, tread lightly with your active ingredients in your skincare regimen. So I love a good antioxidant like a vitamin C. I love a good vitamin A derivative like retinol or tretinoin. And I love a good alpha hydroxy acid and other things that we put on our skin to keep our skin healthy from the inside out. But you have to be careful during the fall months because our increased level of sensitization will be heightened because of the drop in humidity and temperature of the air in the atmosphere in the fall months. So usually it's great to be on some type of vitamin A derivative to kind of reverse the sun damage that we had during the summer months, but you want to just tread lightly, go low and start slow. So if you're using a retinol or if you're using a tretinoin, maybe back off. You can back off by the frequency that you're using, or you can up it with the level of balance that you're using it with. For example, if you're using a tretinoin every other day and you're using the sandwich method, then maybe back off to every 3rd night and still use the sandwich method. And the sandwich method is basically putting on a hydrator, then your tretinoin, and then a hydrator again. Or you can mix a pea-sized amount of your retinol or your tretinoin with an equal parts or a little bit more, like double the amount, a 1-to-2 ratio of a hydrator, and then apply it to your skin. Because studies have shown that vitamin A derivatives efficacy does not get decreased, but the level of irritation gets decreased when you mix a vitamin A derivative with a hydrator or a moisturizer. Also, you want to decrease your skin's exposure to fragrance, alcohol, strong acids, sulfates, and other chemicals that could be really wreak havoc on the skin. It's really important to increase your level of ceramides, natural moisturization factors, DNA repair enzymes, peptides, things that are going to strengthen the barrier, DNA repair enzymes, I'm not sure if I said that already, but all the actives in the skincare that's going to reinforce your barrier and also hold on to hydration within the skin is really, really important. So although we still want to use our actives, including our antioxidants and our vitamin A's and our AHAs, you want to sandwich that in with a little bit more support for your barrier function of your skin and up the use of your peptides, ceramides, DNA repair enzymes, and so forth. Next tip is lips. Lips need TLC too, especially during the fall months as the humidity and temperature drops. We can not only get chapped lips, but also a phenomenon called angular cheilitis, where we almost get like a fissuring and irritation in the corners of the mouth. Now that actually happens sometimes as we sleep because there could be saliva that pools in that area, and a yeast called Pyrosporum ovale can proliferate and cause irritation. It causes this positive chain reaction where you get this irritation and fissuring of the skin, and because the skin is fissured, microbes and antigens and pathogens get in the skin, and then it gives this revved up inflammatory cascade, and you get these dry, chapped, fissured lips. But it can also happen in the mucosal part of the red part of the lip as well. So it's really important to maintain a healthy barrier in your lips as well. And I recommend a lip mask, and a peptide infused lip mask is always essential because not only is it going to seal in the moisture and hydration, but it's going to reinforce the barrier, because the skin on our lips is just like the skin on our face. During the fall months, it can get dry and it can get chapped and it can get irritated, and then it can get even more inflamed, which is positive cascade reaction that leads to, swollen, chapped, dry, fissured, cracked lips. Also, doing a little bit of Vobella, which is actually an FDA approved product. It's actually a lip hyaluronic acid based filler, but I actually have a mountain man who comes in for dry chapped lips once a year, and I give him lip injections with Vobella, which is one of the only FDA approved hyaluronic acid based fillers for lip hydration to pull water into the lips to help with dry chapped lips as well. But if you're using a lip mask or some type of occlusive active on your lips, it's most important to put it on at night, because that's when you're going to be sleeping uninterrupted, hopefully between 6 to 8 hours, where your lips can hydrate themselves and you're not going to be eating or licking your lips or wiping it off. But of course, you want to use it morning, noon, and night if you can. But the most important time to put on your lip mask or your lip balm is at nighttime, and especially getting into the corners of the mouth. Next tip, SPF. Don't forget to wear your sunscreen in the fall months. I feel most of my skin-obsessed patients always wear sunscreen day or night, and regardless of the season, but it's not a true fact that when the sun is not, blazing and when you don't have a high UV index, you're not safe from getting photo damage. So even during the fall months, even on cloudy days when the UV index isn't high, you can still get photo damage. So it's really important to wear your sunscreen year round. And remember, the UVA rays pass through clouds. UVB rays are the UV rays that cause more skin cancer, and UVA rays are what cause more photo damage. Breakdown of collagen, breakdown of elastin, melasma, hyperpigmentation, brown spots, solar lentigines, and so forth. So if you're wearing, if you're on a cloudy day, you don't have to worry as much about the UVB rays, but the UVA rays are actually getting unfiltered and can sometimes be more potent. So make sure that, especially if you suffer from melasma or if you just want anti-aging protection, it's really important to wear an SPF year round on your face, neck, chest, back of your hands, everywhere, just like you do in the summer. So seasonal treatments to consider. We always call fall skin rehab season, and this is our busiest time of year with lasers because everyone's trying to reverse and undo the sun damage that has occurred during the summer months. And so Fraxel resurfacing is one of our most popular treatments here in my office. I've been doing it all day. I just finished clinic just a few minutes ago, and it's a great laser because not only does it reduce photo damage, because it makes the skin healthier and it makes the skin more beautiful, because beautiful skin is healthy skin. It actually decreases your risk for skin cancer by 50%. There's a recent study out of Harvard Mass General. Actually, one of my mentors who was an author on this study showed and demonstrated that fractionated laser resurfacing reduces skin cancer and precancers by 50%. And it makes sense because all the things that cause weather-beaten, not very pretty skin, like brown spots, sun damage, wrinkles, fine lines, broken down collagen, solar elastosis, all the things that give us a not very cosmetically pleasing look, also gets us more predisposed to skin cancer. So when you reverse the changes and you have anti-cancer benefits because the skin's healthier, the skin's more beautiful because you're reversing all those changes that have occurred from damage from photo damage over the summer months. So if you don't do a Fraxel or don't do a laser resurfacing of some kind to make your skin look prettier, at least do it for your overall skin health, which is the most important. Next tip, boost with antioxidants. And I'm not just talking about antioxidants we put on our skin, but also ingesting them in our diet. Green leafy vegetables and food that's going to fuel our skin, packed full of antioxidants, is going to help free radical scavengers, reduce oxidative damage and stress, and will help protect our collagen and elastin for photoaging, anti-aging benefits. So not only do we want to be applying antioxidants to our skin, like vitamin C, L-ascorbic acid is one of the most powerful vitamin C derivatives for the skin that has the most research and data supporting its use and efficacy in overall skin health, but also ingesting, our fruits and vegetables, leafy greens, and foods that are antioxidant rich to have systemic absorption that gets to the skin as well, to help manage free radical damage and for free radical scavenger activity in the skin. And this will not only create healthier skin from within and on a cellular level, but also protect our collagen and elastin from getting broken down. Collagen and elastin are those structural matrix proteins that give skin that beautiful, smooth, tight turgor that we start to lose as we gain wisdom and have birthdays and get exposed to environmental stressors and ultraviolet light and so forth. So get a good antioxidant. Make sure that you're using it in conjunction with a good moisturizer or hydrator so that you don't get sensitization of your skin from your antioxidant, and make sure you're eating your antioxidants just as much as you're putting them on topically. So the MDAiRE Vitamin CFK is probably our top selling product, and it is an L-ascorbic acid containing vitamin C blend that's packed full of other antioxidants to correct and protect the skin without causing too much sensitization. And it's really important to have those free radical scavengers kind of binding up free radicals and helping to undo any oxidative stress that could be upregulated during the fall months. So body and hand care during the fall months, just like the skin on our face, the barrier and hydration status of the skin on our body is also really, really important. Sometimes skin on our body, like our arms and our legs, can handle or withstand more occlusive creams and hydrators than our face can because we're not as acne prone on the body as we are on our face. But it's really important immediately after a shower, not too hot of a shower, you immediately want to moisturize when the humidity is still in the bathroom air, like after you get out of a bath or a shower and you look in the light and you can see the little water droplets, you know that there's a lot of hydration in the air. That's the time when you don't even have to dry all the way off completely. I remember in dermatology residency, they would say just pat dry with a towel or sometimes even just brush off the water after a shower and immediately hydrate with a heavier cream. You can even use like a Cetaphil cream or whatever cream or hydration or moisturizer you like, but do it while your skin is still damp and while there's still hydration and moisture in the air, and that will seal it in. I also like to apply moisturizers or hydrators to the body twice a day. So if you only shower once a day, do it, morning and night. And if you shower twice a day, of course, do it every time after you shower. But doing it within minutes after getting out of the shower or bath is really, really important. If you wait 10 minutes and you leave your bathroom and you go and you're talking on your phone and you're walking around in your living room and you're like, okay, well now I'm going to put on my moisturizer or my hydrator or my heavy creams or my body creams, it's not going to work as well as if you do it immediately after bathing. So that's my one important fall take-home point that I learned in residency, and it was really, really important. It can make a huge impact on your skin during the fall months where the skin gets dry and cracked and chapped and irritated and itchy. Also for our hands, during our fall months, they can get really dry and chapped and irritated, and dry, cracked, fissured hands is something we see in dermatology during the fall months, especially when people are in services where they're washing their hands a lot. Or me, I was a Mohs micrographic skin cancer surgeon for decades, and my hands would get fissured and dry from the soaps that we had to use to constantly scrub through procedures and surgeries throughout the day. And one of the best take-home tips that I've gotten, and actually I give to my patients who suffer from dry, cracked hands during the fall months, is using some type of an occlusive ointment, even if it's like Aquaphor or Vaseline. Sometimes people have a sensitivity to Aquaphor because there's lanolin in it, or even just a really heavy moisturizing cream like CeraVe or Cetaphil. Wrap it in saran wrap, put your cream on your hands, wrap it in saran wrap, and then put a sock over your hands and sleep with them in mitts. And in the morning, your dry, cracked, fissured hands will be healthy and soft and supple and hydrated. And if you do suffer from really bad either dyshydrotic eczema, which is kind of the blistery, itchy, cracked, fissured, dry hands or chapped hands, do that a couple nights in a row, and it will help strengthen the barrier, keep the hydration within the skin of the hands, and will help kind of cut that positive vicious cycle of the itch that rashes, that we call it in dermatology. Because the more you itch the skin, the more fissures you get in the barrier, the more antigens and environmental irritants get into the skin, into the bloodstream, and then you have this really aggressive response and inflammatory cascade and histamine release, and then you keep itching, and then it's just this positive cycle. So you cut it by using occlusive, some type of a hydrating cream, Aquaphor, Vaseline, some type of saran wrap or even a Ziploc bag on the hand, and then put a sock on it, because the heat and that occlusive action while you're sleeping in the morning will help drive all the hydration into the skin and reinforce the barrier. So transitioning your skincare routine into the fall months should be focused on hydration and protection and incorporating active ingredients that are not going to over-sensitize or over-irritate the skin. So if you enjoyed these tips and tricks, drop a comment in the comment section and ask me for any other advice or questions that you guys want to hear about. And thanks again for watching. All right, love you guys and see you next week.